What was that recipe you gave us in the class the other day? It was so good.
There was one I figured out, ranch dressing. How to make ranch dressing out of buttermilk and low-fat sour cream and garlic.
Oh, it was wonderful. It was wonderful. I love it when you bring to class a sample of what you've made, because you just make the most terrific things that all bariatric patients should.
Well, it's been fun trying to decode some of these recipes. You have it out somewhere, and it's kind of been fun trying to figure out what exactly am I eating, and I wonder if this can be adapted to something that I can eat and share with my support group. And so yeah, that's been a lot of fun. But yeah, lots of swap outs for things, lots of substitutions are just all over the place. If you open your eyes, you can substitute anything.
Well, you've done a wonderful job. I'm really enjoying our support group. I'm getting so much out of it. And I love meeting all the people there.
Definitely.
We've got some really good, dedicated staff, as well as dedicated people coming to the classes, and I think it's been terrific.
Well, it's been so fun to see the changes in everybody from the beginning when we were all heavy, and we've all been shrinking together, and you know, and hopefully are going to all stay small together.
From the time that we waddled in,
yes,
until the time that we're walking out.
Yes, sauntering out.
Sauntering out.
And
I
all
love
of our
that.
new clothes, and but it's that little bit of accountability that we have every week, going in there and getting weighed, and just knowing, you know, that you're going to be seeing the team that took care of you.
Yes.
You know, you don't want to disappoint anybody, yourself, your friends, the team that took care of you. It's that little bit of accountability that really keeps me.
It does, and it's good to listen to a lot of the people that have been through the surgery, how their struggles are coming along, and what exactly they're doing to make it right, to keep on track, and to keep moving forward.
What's so funny is
it's kind of an inspiration to all of us.
Oh, sure. Well, it seems no matter what somebody's having going on, you know, any situation, it seems like we've all either been there or can help with it.
Oh, yeah.
You know, you get somebody new coming in that, you know, can't stand their new protein supplements. And
we all go, oh,
we've all been there. And, you know, we've all been there, and we've all worked through it. And, you know, a lot of times we can help people just like, you know, other people helped us. And like you helped me when I first went in there. You were a few months before me, and I remember going into this group thinking, I want to look like Pam.
Oh,
you know,
you're so sweet.
But it's funny to see that, because you get that inspiration from the other people.
You do. You really do.
Yeah.
It's been wonderful for me.
Absolutely.
Too. I never want to miss a support group. I want to go to them all if I can.
Yeah.
Because Dr. Randall and Sarah are so helpful. There's a Thursday night support group I don't get to as often, but they bring in, they brought in plastic surgeon, they brought in, of course Sarah speaks on diet, but they bring in a lot of interesting speakers that can help all of us.
Did you see the exercise specialist? Did you go to that one?
No, did you go to the belly dancing one?
No,
yeah,
I missed the belly dancer. I wanted to go.
Yeah.
You know, I went to the exercise specialist and got some really good tips. Just wouldn't have thought, you know, working out like with weights or anything like that would be for me, but no, I listened and went out, and I actually got some dumbbells for Christmas that year. So it's been, you know, it kind of opened me up to some new ideas, you know, learning, yes, you can use weights without looking like a bodybuilder. So it was lots of good information that you get from there. I missed the plastic surgeon one, but I wanted to go see that.
Yeah, well, I did see it, and I don't know. I don't think I'm going to go through any plastic surgery.
No.
This was enough for me, but
yeah, this was enough too.
But I think with the right exercise and the positive thinking, we can get through it.
Absolutely. I think exercise is just paramount with this, just with toning, and I don't know how you could do this without exercising and, you know, keeping that new body going and staying in shape and conditioning and all that. It's just been so much easier to work out when you're...
Yeah, and I've loved meeting people in class and meeting you, seeing your son. He's such a good sport. He comes along with you and sits out there and waits for you patiently. He's so sweet. Does his homework.
Well, with support group, I mean, it kind of goes beyond the little group that we go to too. It's you know, it's kind of an extension of your family. I mean, my family is so helpful with all of this, and my son can read a food label better than most grown-ups can, and you know, to have that extra bit of support outside of, you know, our group, it's you know, that little bit of reinforcement that I think is good for all of us.
Oh yeah, absolutely.